Good morning, everyone. Thank you for joining us this morning. This is a briefing for the Alexandria businesses on the current COVID-19 surge. So we understand that there is a lot of information right now available for all of us to consume about what's happening with this latest surge. And we thought it was important before many of us take a holiday break to check in with you and give you the opportunity to ask questions of our partners at the Alexandria Health Department. So quickly this morning, here's our agenda. We're going to introduce you to the panelists and let you know who is available to answer questions. We'll do an overview of where the city of Alexandria is in terms of the surge. We'll provide you a brief overview of President Biden's messages from yesterday and anything that might be of interest there. Our colleagues at Alexandria Health Department will walk you through a review of best practices for businesses given the surge. And then we'll go through the latest news on the OSHA workforce or the OSHA vaccine rule, where there was some developments over the last few days. And then finally, we'll end with questions and answers. So please use the question and answer feature on Zoom. If you go to your menu, you'll see Q&A and you can type in questions and then we'll take them at the end of the presentations. So available today for the business community to hear from or ask questions are Rachel Stradling. She's really, I think, the most important panelist. She's the environmental health manager at the Alexandria Health Department. Many of you who work in the restaurant business know Rachel well. And then my colleagues, Carl Moritz and Ann Horowitz from the Department of Planning and Zoning. So many of you who have been using outdoor space or taking advantage of some of the other changes that we've made over the last 2 years know both of them well. And then our colleague, Kendall Taylor, who runs the city's finance department. So if there are any questions on that front, she is available to answer questions as well. And with that, we will head right into the slides and I'll turn it over to Rachel.
Okay, so I think this slide is fairly obvious for everyone to see that we are experiencing a significant surge right now in our COVID-19 cases. So we had been kind of teetering along in between substantial and high for quite some time. And now we're significantly in the high transmission, experiencing, over 500 cases per 100,000 in the last 7 days, which, is a significant increase. Looking at our case numbers for today, we haven't plateaued yet. Hopefully that will occur, shortly, but Omicron is our dominant variant now across the whole of the US. So we do expect the high transmission to continue, at least for the foreseeable future. Now, the good news is, Alexandria does have an incredibly high vaccination rate, which you can see on the next slide. And, that's really our key messaging to everyone that's on the call today is to encourage all of your staff, all of your family members, everybody that you know and communicate with to get the vaccination and to get the booster vaccination too. It's really widely available in the community. So if we can get that box that is currently in the gray and the people that are partially vaccinated to join us in the dark blue box, that is our best strategy for defeating COVID-19 and keeping everybody safe and healthy. So that's really the data. I know that it's widely publicized, that there is a surge going on. So yes, there is a surge. Those people that aren't vaccinated, unfortunately, are 4 times more likely to get sick than the people that are fully vaccinated. And unfortunately, if you're not vaccinated, the data is looking like you're 5 times more likely to end up hospitalized than somebody that is fully vaccinated. So I cannot encourage you more strongly to get vaccinated, to get, and to encourage everyone that's working for you to get vaccinated. So that's kind of the data and where we are right now. And I dare say there'll be lots of questions at the end on that, but that's a quick overview of the current status in Alexandria.
So quickly, yesterday, President Biden addressed the nation and announced a few things that might be of interest to all of us as individuals, but also as business owners. His message was one of not trying to lock down the country, and said a number of encouraging things about the ability for school systems to stay open, and really pointed to what Rachel just said as our strategy is to get everyone vaccinated, but to really then focus on testing. And the big announcement was that the federal government is going to provide 500 million at-home tests to anyone interested. The unfortunate piece of that is that those tests won't be available until January. They will be setting up a federal website for all of us to use and to request those tests. They also will be setting up more federal testing sites. And so encourage you all to continue to follow that information. I think we should also mention that here in Alexandria, we have 3 curative testing sites, curative.com, which are available for you or your employees to go and get tested. As you might imagine, the numbers that we're seeing there are also extremely high over the last week. We had been seeing somewhere in the hundreds every day getting tested, and now we're well over 1,000. And so we encourage people to continue to use that free resource, but also be patient, recognizing that everyone is trying their best to be knowledgeable about status, especially as they look to gather over coming days. So I'll turn it back to Rachel.
Okay, so obviously these are fairly common sense CDC recommendations for everybody, but I want to make sure that we go back through it. So if you're fully vaccinated, because Alexandria is obviously in high transmission right now, we should be wearing masks inside in public settings. And as Stephanie just mentioned, we do have free testing options in Alexandria. So we are recommending that, if you're experiencing COVID symptoms, that you definitely get tested. And then if you're in a close contact with somebody, testing 5 to 7 days after that close contact. If you're thinking of participating in kind of family gatherings, again, recommending that we have testing before we gather. And again, testing is available in the city for free, but as Stephanie mentioned, we are experiencing a significant increase in the request for testing. So please be patient. You can also buy tests, from most of the pharmacies. Again, making sure that if we are doing any indoor events or indoor social gathering, that we're wearing our masks, trying to space out as much as we can. And then what else we're doing at the health department is obviously encouraging people to try to do more activities outside. It's basically a rollback to where we were kind of this time last year, but there are no mandates in place. It is all just really common sense recommendations and trying to keep people safe. And as I say, the most important thing that we can do is vaccinate and get boosters. And then just moving on to some of the guidance thank you, Stephanie. So that's kind of just going back through what I just said about getting vaccinated, rapid testing if you are going to be gathering together. Moving on to the business guidance, again, it's very similar to what we were saying 12 months ago as, we were going into, the COVID surge last winter. Fortunately, this time we can obviously say that vaccinations and boosters are our key strategy for combating this. But again, restaurants might want to consider moving their tables just a little further apart, potentially going back to some of the outdoor dining options that we had last year. And obviously, Anne Horowitz, who's on the call, can give some guidance on outdoor dining and the patio heaters and everything that we kind of did last year. It's not a requirement, it's not a mandate, it's just good common sense, guidance to obviously space out, open windows where we can, making sure that we have hand sanitizer available for our patrons. Consider going back to curbside pickups. People are obviously nervous about Omicron. Everyone is watching the news and everyone is seeing that across the country we're having a surge in cases. So being able to offer your customers, the pickup options like we did previously, really does help to obviously mitigate some of those cases. So it really is a little bit of a rolling back, but thankfully, as I say, we have vaccinations, we have boosters. People's mask habits are completely different to what they were 12 months ago. People are much more used to wearing masks. We have some really awesome signage available that you can download and print, which looks really attractive on your windows. So, we encourage you to download those. And there's a variety of different posters that are available as a free resource for people to download and to print. So as I say, the key message that I really hope everyone takes away today is please get vaccinated. Please get a booster. If you're sick, don't go to work. Please isolate. Due to the number of cases that we're getting, we're not able to contact everyone in the city that is testing positive. So if you do have a positive test, please be proactive. Please contact people that you've been in contact with to let them know that you've been diagnosed as positive so that they can do the right thing too. Okay, that's about all I have to say. I think I have said enough times. Please get vaccinated, please get the booster, and please wear your face mask if you're inside.
So the last piece of somewhat breaking news that we wanted to share with you was a the temporary stay that was lifted just at the end of last week for this OSHA COVID-19 vaccine rule. This is a workplace standard. It was an emergency temporary standard that was published in November, and it applies to large employers with 100 or more employees. But we also know that many smaller employers have been using this as somewhat of a standard to follow as a best practice. And so what the temporary stay lift means is that OSHA will begin to move forward with compliance in the beginning of the year, barring any other challenges. And as you'll see here, the requirements of this standard are that every employer develop and implement and enforce a vaccine policy. So basically a vaccine mandate. You are responsible as an employer to determine the vaccination status of your employees, and you have to collect that information and protect it. You need to provide paid time off to employees to get vaccinated, and also to allow them paid leave if they have a reaction over the course of the days following their vaccination or booster. You need to ensure that all non-vaccinated employees are tested for COVID weekly. And again, using things like the curative system to do that seems to be a best practice. You also need to require that your employees provide notice to you when they test positive so that you can help with the contact tracing, as Rachel just talked about. And finally, you need to require that any unvaccinated workers remain masked 100% of the time that they're working. And so we've provided the link here. We will send out these slides to everyone who registered when we're done here today so that you can follow these links. But again, this is breaking news as of Friday. This standard had been passed in November. It was immediately challenged, and then we've sort of been in a holding pattern. And again, a lot of employers have been following these as a best practice, but the news as of Friday is that OSHA will begin to implement I guess their oversight of this beginning in January. So employers are considered to be kind of on notice. And so now we'll move to questions. We have a few that have come in so far. So I'll start and ask Rachel. There's a question about how accurate are the at-home tests compared to the PCR curative tests?
So we always say that the PCR tests are the gold standard in testing. So clearly, they are, the most accurate test that you can have. But the at-home tests have become increasingly accurate over the last 12, 18 months. So they are definitely, one of the tools that we can use. What we say is if you do test positive for the at-home test, it's always a good idea to get the confirmative PCR test, but they really are a good indicator and will at least give you, that, reassurance, hopefully, if you're testing negative, particularly if you're meeting up with elderly relatives or, doing an event, something like that.
So Rachel, someone is asking, why do we still refer to full vaccination as 2 shots of Pfizer or Moderna and not address boosters? Shouldn't we now be saying that you are not fully vaccinated unless you get 3 shots?
So the CDC still says that fully vaccinated is 2 shots of the Pfizer or the Moderna, plus obviously the 2 weeks after you have your second dose. So the CDC hasn't changed yet, but obviously that booster shot is incredibly important for those people that have been vaccinated, a little while ago. That's what gives us that ultimate protection, after we've had that initial kind of 2 shots.
Is the Johnson & Johnson no longer being provided based upon the assessment that it's not as effective as the other options?
So Johnson & Johnson is still available within the community. It's still an approved vaccination, and it's still available for those that want it.
Great. How does Alexandria positive cases compare to the rest of the region/nation?
So everywhere is experiencing a surge in cases right now. So it's fairly comparable, unfortunately, with the rest of the nation. We are incredibly great with our data in Alexandria, and we are very quick at getting our data out into the community. But, you know, this is a nationwide problem, and it's something that we need to tackle as a community together, all doing the right thing.
Another question is there any indication as to when federal testing sites will start to open? Is it known if one will be close to or in Alexandria? I am not aware of any definitive plans yet based on the announcement yesterday. I believe when I read through the announcement in more detail, it said that we wouldn't start to see any federal testing sites until January. I think the first ones are focused in New York City. But I don't know if Rachel has any more information.
I haven't heard anything about a federal testing site near Alexandria, but I'm going to do a plug again for the curative testing kiosks that we have, which are free in Alexandria and are already available for everyone to use.
Thank you for encouraging curbside pickup and to-go meals. And maybe this is for Anne or Carl. Can the city replenish the disappearing curbside pickup signage?
Sorry, Tamiki, I'm muting. Yes, we will check into all of that and replace what is missing. And right.
Yes, absolutely. I will get a note out to the Transportation Environmental Services to replace those signs. And if anyone would like to contact me directly to let me know where those might be missing, that will be very helpful.
Excellent. For Rachel, if the health department is recommending masks indoors regardless of vaccination status, how can the city encourage businesses to follow this policy?
So we are obviously doing an awful lot of messaging, encouraging all businesses to follow the indoor mask recommendations. So there's lots of messaging going out. If anyone needs any specific advice or education, we have an awesome person that works on my team, Amanda Gamble, that is happy to provide education and advice to any business that needs it, totally free of charge. We also have some awesome resources that one of my colleagues just texted me to make sure that I remind everyone about. We actually have bathroom posters, we have coasters for tables. So if anyone wants any of those resources, I'll pop the person's email address into the chat. Just email them and say how many posters you want for your bathrooms. They're a little cheeky messaging. So you might want to be selective which bathrooms you put them on, but it's bathroom humor. It's supposed to make you smile and most importantly, encourage vaccinations. And then we have coasters, as I say, for tables. So we have a ton of messaging to help people. We put information out on a weekly, even a daily basis right now, encouraging people to wear masks and to do the right thing. But, you know, it's a difficult one. There are no state mandates coming for masking. So it's something, you know, we have to really encourage everyone to do the right thing.
Great. There's a question, I guess maybe for Rachel. It's OSHA, so I will just disclose that neither one of us are Department of Labor officials, but we've been following CDC guidelines such as wearing masks indoors. Is the OSHA COVID-19 vaccination rule a policy that is officially recommended by the CDC for employers with fewer than 100 employees?
Oh gosh, I honestly don't know the answer to that. But following the CDC guidelines, it's always awesome best practice. So, you know, if the CDC is recommending in areas of high transmission that we wear a mask indoors, then that's what we should be doing for our safety and everyone's safety. So if it's a CDC recommendation, I would say it's best practice.
Are there any other resources coming available for more testing sites or more at-home rapid tests for Alexandria businesses and citizens? I can say, start out by saying you might have heard that our library system has been providing free tests for anyone who goes to the library and asks. But like all of our drugstores and retailers, they have also had trouble keeping a supply because the demand is so high. But I know that they are working to replenish their stock as quickly as they can, and will continue to provide those tests available to any Alexandria. Frankly, I think it's anyone who walks into the libraries, but certainly to Alexandria residents and businesses. For Carl and Ann, can the city also address retailers who are taking up parking with unused tents?
And yes, we can. And again, if there are any specifically that you would like to identify, please send me a note. My email is, I'll say it very slowly, I hope, ann.horowitz@alexandriava.gov.
Thank you. I know our colleague Katie North is also on from transportation, and she works extremely closely with Ann and Carl and I on issues like this. Are there cases of long haul illnesses from any variant for people who have had the booster? If so, what percentage are they of people who have contracted the virus after being boosted?
I'll be honest with you, I don't actually know the answer to that one, I'm afraid. But I can definitely look into it and see if there's any information on that.
Thank you. Somebody asked the question about the libraries, so I think we've addressed that. There's a question about business capacity. I'm curious, have other businesses allowed full capacity? At my entertainment venue, we are still only allowing 50%. So that's a little bit, I think, of more of a question for the people who are on the call here. But Rachel, you might know, as you've been out, talking to restaurants and other venues, if kind of what the standard has been around Alexandria.
So I think the entertainment kind of industry has been cautious as they've kind of transitioned from obviously mandated numbers that they can have at their facilities to having no mandate. So I think, that is one of the sectors that has been slightly more cautious. But I would say many of the businesses have returned to 100% capacity. They've just transitioned perhaps more slowly.
Can a business refuse to serve unvaccinated patrons or have them test before coming in?
Oh gosh, I would say that's one for your attorneys as to when you can refuse service and when you can't refuse service.
There's a question about whether Alexandria has seen an increase in hospitalizations and or deaths with this spike, or is it more cold flu type symptoms?
So we're still really early into the surge, as you saw kind of at the start of the slides. We've only been seeing, this spike, for the last week or so. So it takes a long time for that kind of to translate into, deaths and hospitalizations. My genuine personal hope is that this really is just cold and flu-like symptoms and it doesn't turn into something more. But we're watching, we're waiting, we're analyzing the data. And as we have more kind of definitive information, obviously we'll be sharing that with the community.
Are public events in jeopardy of cancellation, specifically First Night Alexandria? There is an indoor component in 6 locations. Masks are required for attendance and capacity limits are capped. What else must be done to support health and safety?
So that's something that we're discussing. I had a conversation yesterday with Dr. Rose, who's our new health director, about how we manage our larger events. Obviously, there are no mandates coming from the state. Like last year, it was a lot more simple. When you're told that you can't do something, the decision is incredibly easy to make. So we are having discussions. We are trying to work out what is the best strategy for our community. How do we make our events as safe as possible? And that's an ongoing conversation. And hopefully, we'll be able to make some decisions shortly on that and to give some really good advice if we're going ahead with these kind of events.
Great. There's a question about where to find the free signage. So we are posting that in the Q&A so people can pull that link. Someone said that they were told the curative sites are out of PCR tests. When will the tests be back in stock at the city testing sites? I would like to let our business members know when they are back in stock. I can report that we heard yesterday that there were 2 of the curative sites in Alexandria that did run out of tests temporarily, but they were restocked as of yesterday morning. We heard that Monday morning, I'm sorry, and they were restocked as of Tuesday morning. And I think our colleagues are actually out right now looking at the curative sites, but as far as we understand, they are restocked. But I do think that that is, again, something that as a community and I think as a nation, we're going to be struggling with over the coming weeks, is that the demand for testing is stronger than it's ever been, mostly driven by obviously this surge, but also because we're all hopefully gathering with people and have a lot more reasons to test over the coming weeks. What is the quarantine period if you think you were exposed or near someone that tested positive, but you have not tested positive yourself?
Okay, is that person vaccinated or not vaccinated? Because that very much kind of sets the stage. We have a whole pile of information on the different scenarios on our website, and I will ping that to Stephanie so that she can type it into the chat so you can work out your individual situation to make sure that you do the right amount of time and the testing at the right point.
Great. Someone's asking if we are expecting to see a rollback to 50% occupancy before New Year's Eve. I think Rachel just addressed that. The occupancy and the guidelines that we were enforcing here in Alexandria over the past 2 years were set by the state and the governor, and there has been no indication of any changes expected there in anytime soon. So unless and until that happens at the state level, I don't believe that there's going to be any mandates, but I think our intent today was to talk to the business community about the statistics, et cetera, and encourage you all to help stop the surge by making some maybe small tweaks voluntarily. I've seen some recent recommendations that paper masks, surgical, and KN95 are preferable to cloth masks now that there is no longer a shortage for healthcare professionals. Are multi-layer cloth masks with no valves still considered sufficient protection?
So the CDC still says that the cloth face covering, providing it covers your nose and your mouth, is adequate. Obviously, the KN95s and the surgical masks, are better. And when there was a huge shortage of them, obviously we were recommending the cloth ones for that increased level of protection. Then obviously, the N95s, the KN95s do offer, significant, they're used by healthcare workers to protect them when they're actually treating positive patients. So they do give, that extra protection. But when you're just going about your normal business in the community and your interactions are short, and you're not kind of in the same space for a prolonged period of time, the cloth face coverings, providing they cover your nose and your mouth, do give good protection.
There's a general question if people who have not been vaccinated are more likely to transmit COVID to vaccinated people as opposed to people that are vaccinated.
So I think I haven't seen any research or any data that kind of says, if you're positive for COVID, that there's a difference in, if you're vaccinated or unvaccinated in how transmissible, I'm wondering if that's the right word, how transmissible you are in giving it to somebody else. I don't think there is that kind of distinction, not in any of the data that I've seen.
I think a similar question about, whether the Omicron variant is more contagious if the exposure time is less. And it sounds like your answer, Rachel, probably holds for that question as well.
Yeah, and it's really early on with Omicron. We're still really studying it. It's new, it's different. It appears to be more transmissible than Delta, but it's still super early on to know that. So the vaccinations work. So, that is our best strategy, is to get vaccinated if we've been vaccinated, or get the booster shot. That's our best strategy to getting out of this COVID-19 situation.
Thank you. Well, I think we have reached the end of the submitted questions. We answered 25 questions, which is great. Again, our intent for today was to reach out to the business community to acknowledge that the conditions have changed, make sure that we're passing on any information that we have to you all, to remind you that there is an open door always to reach out to us, to ask us questions. The business community has been an amazing partner to help us continue to live through this pandemic and still provide important employment and recreation and, frankly, escapes for our community. And we appreciate how safe and committed to safety you all have been. So please, over the coming weeks, as things continue to change, reach out to us, ask us questions, and tell us, give us suggestions about things we can do to support you so that you can stay healthy and open. We will send out these slides to everyone as soon as we're done here with some of the links, and continue, as I said, to reach out to any of us with questions. We wish you all a happy and safe holiday season, and we hope that all of your businesses remain economically healthy as well as physically and mentally healthy. So thank you all for joining us today, and we will be in touch in the new year.